Alright, team. We have a patient presenting with vasculitis, skip lesion, and enterotoxin type D. What are we dealing with here?
It could be Crohn's disease. The skip lesion is a common sign.
But the enterotoxin type B points more towards a bacterial infection, maybe Clostridium difficile.
I think it's more likely to be Kawasaki disease with the vasculitis symptom.
Actually, I'm leaning towards Bouchet's disease with these symptoms.
Enough. It's Eurocat, damn it. And I don't want to hear any more theories. We're going with that diagnosis.
What the fuck is a Eurocat, Hawks? Some kind of exotic animal?
We don't have time to debate. Now here's what we're going to do. We must perform a radical perineal prostatectomy on the patient.
But that's a risky procedure, Hawks. Are you sure it's necessary?
I'm sure. This is the only way to save the patient. Prepare for surgery, all of you. We're saving a life today. Tracy, I need to talk to you about performing a radical perineal prostatectomy on my patient with Eurocat.
Hawks, you know we have to follow proper protocols before jumping into such a serious procedure.
Protocols have been followed. I told you I'm doing this, and now you know.
That doesn't mean I've signed off on this.
I don't really care.
Is everything all right with the patient after the surgery?
Actually, Randall, I just checked the latest reports and the patient is in critical condition.
Critical condition? How did this happen?
It seems like radical perineal prostatectomy was not the correct treatment for Eurocat, despite Dr. Hawks' insistence.
What should we do now then? What's the right treatment for this patient?
It's okay, Randall, let's not panic. I think we should consider a different approach. Maybe we go to the patient's house, grab the cat, and take it to a veterinarian for further investigation.
Cat. You're referring to the Eurocat diagnosis. You think this is some furry animal with 4 legs that is causing the patient's problems?
That's what Hawks said.
I'm not even going to defend you this time. If there's a God, he is laughing hard right now.
What the hell were you thinking, you incompetent fools? Almost killing a patient because of your stupidity?
Dr. Hawks, we were unable to retrieve the Eurocat and the patient is in critical condition.
Yeah, it seemed like the most logical choice at the time.
We were just following the standard procedures, Hawks. We didn't mean to harm the patient.
Hold up. Did anyone else hear what Gary just said?
I didn't.
That's probably because your ear holes jam shut whenever your jaw moves, you dumb man-child.
I can't believe this is happening. What do you think the real diagnosis is, Hawks?
You idiots couldn't diagnose a cold correctly, let alone a serious condition like this. The real diagnosis is clear as day, but you buffoons wouldn't know it if it hit you in the face.
Cats are not good to take to the face, especially if you're allergic.
We want to learn from our mistake and do better next time.
Yeah, we're truly sorry for the error. Just give us a chance to make it right.
Team, we need a Garyectomy right now. Please remove him from the premises.
It's winter, Hawks. He might freeze to death.
If that's finally what removes this persistent ass migraine from our lives, then that's what it takes. Hey Johnson, how are things going in the oncology department?
Oh, the usual. Some tough cases, some good outcomes.
Bet you got a bunch of dead ones this week.
That's not pleasant. Anyway, what's been going on in diagnosis land?
Well, the symptoms were all over the place at first in this one case, but I think I finally connected the dots.
Really? What's the diagnosis?
It's a rare autoimmune disorder. I can't believe I missed it before.
A rare autoimmune disorder. How many of those do you find per day?
About the same number as patients you have to tell good news to.
That's the last one, Hawks. Shut the hell up.
Storms into the room, knocking over a tray of scalpels dramatically on the floor.
Goddammit, what are you doing? You can't just barge in here without protective gear?
Yeah, you're putting patients at risk with your reckless behavior.
Listen, Eurocat got it all wrong. It's not what they think.
What do you mean? What are you talking about, Hawks?
I diagnosed it during lunch with Dr. Johnson. It's galactocele.
Galactocele. What's the prognosis for that?
Prognosis is good. We caught it early. We just need to start treatment immediately.
Well, even if you were right, you should follow protocol, Hawks. Rules are in place for a reason.
I'll follow protocol next time. But right now, we need to focus on treating galactocele. I can't believe I made such a mistake with the diagnosis. It is embarrassing to admit my doctor's wrong about Eurocat.
But you eventually found the right diagnosis, Hawks. That's what matters. You saved the patient.
It wouldn't have gone wrong if the other doctors weren't such idiots. I had to fix their mess.
What's this I heard about you asking your doctors to escort Dr. Gary outside and into the cold?
They thought that would somehow help the patient, when truthfully they're all selfish candy asses who wanted to remove a personal problem.
Why do I doubt your side of the story?
You doubt my side every day. I don't want to hear it. I'm going home.